enjoyed playing sports may suddenly not try out for the team that year. A child who becomes anxious, tense, they may become panicky, and the source of their anxiety may actually give you a hint as to why they have the depression. The child may also become irritable, or they may lash out in anger towards their parents because of the distress that they're feeling. Some cognitive symptoms include difficulty organizing their thoughts. And this may be evidenced in school. They may have problems following through with their tasks, or they may have trouble focusing on their schoolwork. Some children often feel helpless and they feel hopeless. Depressed individuals somehow believe that there's no way out, that what they're feeling is what they're going to be feeling for a long time. A lot of them also become isolated. They feel isolated, and children who are picked on frequently by their friends, anything their friends say, they may take it the wrong way, or they become very sensitive to these, common slights from their friends. Their friend may just be joking, but they may take it as an attack on their character. Thoughts of death are also not limited to adults. Children have been seen to have feelings of wanting to die, or wanting to kill themselves, and have suicidal thoughts as well. Physical symptoms. These include changes in appetite. A child who normally has a very healthy diet and will eat anything suddenly refuses to eat. Also, children with depression can exhibit sleep disturbances. Children may have trouble falling asleep. They may have trouble staying asleep once they do fall asleep. Or they may have trouble staying awake when they go to school. They may sit in class and fall asleep and not be able to do their work. Other children have trouble sitting still, or they become agitated as well. Depressed children often walk, react, and talk slower than, say, a normal child with no depression issues. Some behavioral changes can be seen also. These include withdrawal and avoidance. Children with depression may avoid their normal, enjoyable activities, such as going to the park, hanging out with their friends. A lot of them will isolate themselves and go to their room. Their room may be their favorite escape from what they're feeling. And just for solitude and for an escape, they will go and stay in their room. Other children become overly dependent on some relationships. For instance, a child, say 8, 9 years old, who never whines, never is clingy, may suddenly need their mom everywhere they go. They may regress a little bit and always need to be touching their parent, or never want their mom to leave them if they're in a room or in a new place. And this is not normal for an 8-year-old, say. The depressed child may also cause physical pain to themselves. Some children will scratch their face over and over again. Some children will cause self-harm. They will cut themselves or cause injury to themselves, or they will take excessive risks. They'll jump off buildings, I'm going to jump into the water from the roof of the house. They just do things in excess, or they'll play video games for hours upon end. So, now that we know the signs and symptoms of depression in children, what are the treatments available? Well, in general, what you want to do is you want to get treatment early. You don't want to wait. You want to encourage the child to talk about how they're feeling without judgment from yourself. You also want to encourage encouragement, patience, and support. The two treatments for depression are psychotherapy and antidepressant medications. According to Dr. Jay Hecker, cognitive behavioral therapy has been shown to be successful. Children who are depressed usually have an unhealthy outlook on life and an unhealthy reasoning upon their experiences. So with cognitive behavioral therapy, children learn to develop healthier, more positive outlooks on their life and their situation. If psychotherapy shows no signs of improvement for children and increasing the positive outlook in their life, then antidepressant drug therapy is usually the next choice. But something very important is that doctors should weigh the risks and the benefits involved, because there are many risks associated with antidepressant medications. I'm sure you've all seen the black box warning labels that have been out now on these medications, because it does increase suicidal ideation, suicidal thoughts in children. Prozac is actually the only FDA-approved medication to treat depression in children ages 8 to 18. In conclusion, depression affects children just like it affects adults. There's many signs and symptoms that we talked about, as well as treatment options. The most important thing is early detection. If you suspect your child is depressed, you should contact your child's pediatrician or another mental health provider. A lot of times, if you know somebody that's depressed or a child that's depressed, you can mention, to maybe they can talk to their counselor at school, or a family friend or a priest at church. We just want to keep in mind that depression is a serious illness, but it's treatable.
Thank you.